5 representatives there. So they too saw that it was an issue that we needed to address. So we met on that Monday morning, and had all of the representatives from Cone Hospital, our EMS staff, our health director, our mayors, and our county staff to talk about this issue. And when we heard about Cone's situation as far as the beds they had with COVID patients in July, and then as of that date, they had about, I think it was 7 back in July, and then as of August the 9th, that day we met, they had 88. They had expected approximately 200 by September the 15th if things did not change. That was very alarming to us. When we heard the presentation from our health director, our EMS staff, talk about the staggering figures that we have here, that was facing here in Guilford County. And just to give you a few as of updated information that kind of confirms why we are doing what we're trying to do as far as trying to combat this virus. As of yesterday, we had 739 deaths total year to date for Guilford County from the time that we first had this virus. In my understanding, we have another possibly 8 to 12 that might be coming in as confirmed cases today. Overall, infected by COVID here in Guilford County, we have over almost 54,000 of our citizens that have been infected by this virus. Last week, we had over 1,600, about 1,700 cases, confirmed cases of infections of this disease. And right now, through the U.S., they're having about 1,000 deaths per day. My understanding this morning, there's about 450 kids that have died based because of this virus. So we saw all of these statistics even a couple of weeks ago, and we knew that we had to do something. On that Tuesday, August the 10th, we met as I called a meeting, an emergency meeting with the health board to talk about what we needed to do as a health board / commissioners. And we came to the conclusion we need to put forth a new health rule. And our county attorneys, our staff, put together the health rule for us to consider. We voted on it on August the 10th, to make it effective Friday, the 13th of August at 5 p.m. And then we were notified by our county attorney, and rightfully so, that we needed to have a 10-day notice for this rule to go into place. We put that 10-day notice in on the 16th of August, and made it effective when we adopted it last night on the 26th, immediately upon adoption. So those are the things that we are trying to do in order to combat this virus, this Delta virus, which they say is 2 to 3 times more effective than the Alpha virus. So we're serious about this. We want our citizens to know that we are serious about fighting this virus, but we can't do it by ourselves. And we want to make sure that we educate our citizens on the necessity of fighting this virus together. We know we have some naysayers out there that's not going to be with us on this, but right now we have to go on in spite of that. We have about 47% of our citizens that are vaccinated in the county. About 56% of those that are eligible, that are vaccinated in the county. So we're getting there. We're making some headways, but we still have a long ways to go. People are still dying, getting affected by this virus, and we want to do something in order to combat that. And that's why we are assembled here today, to try to help the media get the message out, the importance of this, us working together and not against each other. That's why we implemented right now the mask mandate for all of our public facilities to be able to make sure that their customers wear masks. And this is a way that we don't have to shut down like we did last year in order to affect the businesses. At least they can have their customers coming in, but they still should be wearing masks. Their employees should be wearing masks in order to protect ourselves from each other. So this is what this is all about, trying to get back to some normalcy. We thought we was going to be back to some normalcy by now, but the Delta virus said, no, 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 I'm not finished with you yet. Therefore, it came back a little stronger. So we have to gear up again in order to protect ourselves against this virus. And let me note also, last year this time, we did not have the advantages that we have now. We have over almost 250,000 of our citizens that have been vaccinated. Last year, we did not have that. It's probably a little bit more now, probably 300,000, but we didn't have that last year. So right now, clearly, we have a pandemic of the unvaccinated. So those that are not vaccinated, those are the ones that basically filling up our hospital beds and causing our emergency services to be delayed. Because 97% of those that's in the hospital now are unvaccinated citizens. So if we can talk to those citizens that refuse to get vaccinated and convince them that this is the right thing to do, not only for themselves, but for all of us, then we might be able to cancel this mask mandate. But the answer to when we cancel it is in those unvaccinated citizens' hands. If we can get to some herd immunity within 2 months, we can cancel the mask mandate. If we can get everyone vaccinated and people abide by the rules in a short period of time, we don't have to go to January 8th in order to cancel that vaccinate. But I tell you this, if it goes beyond February the 8th and the figures are not changed, then we're going to continue our rule and keep on putting it in place. We're not going to relax until all of our citizens are safe and this virus is to some greater degree defeated in the best way that we can. Now I'll turn it over to Dr. Van so she can give some opening comments and kind of tell us basically where we are and why we're trying to do what we're doing and basically the effectiveness of this route. Dr. Van.
Thank you so much, Chairman Alston. I also would like to acknowledge the fact that we do have also Mr. Mark Payne with us, the county attorney, that would be also able to assist us in some legal comments and any questions that may come from the group that we might need to have his assistance on. So thank you, Mr. Payne, for joining us today. I'm going to start talking a little bit about the logistics of the Board of Health rule and the enforcement piece. This is not a new task for us. We have been working on enforcement of public health measures, specifically around the emergency order the governor has put in place at the end of last year. And we've created a process and a flow and a team of individuals that would be responsible for this even at the beginning of 2021. So now we're going to rely on the expertise and knowledge of this group of individuals to help us with this new Board of Health rule and enforcing masks in Guilford County. These are Guilford County Public Health team members that are going to help us with this task moving forward. We do have a variety of team members that are helping with this. We've brought in additional 4 positions at the beginning of the year. So now we're transitioning those 4 positions back into the enforcement piece since they were really helping in our vaccination clinics until now, but now they're taking back their enforcement job responsibilities. And we are also depending on our other regulatory team members that are doing this type of work in the regulatory space every day, regardless of the Board of Health rule. So we do have an entire team that is working on this, full-time individuals, also some part-time team members that are going to be out in the community putting this in place. As far as the qualifications that they need, we are looking for individuals that have some public health background. We have looked for health educators and individuals with experience in the public health field, since we know that the road to compliance is through education. So having individuals that are very well versed in the public health mitigation strategies and just work in general was critical to us. So those are the individuals that we have brought on board and that are going to continue this work in the community. They are going to be responsible for triaging the calls that are coming in and the violations that are being reported to us. They are tasked with outreach and education to proactively and in prevention of any violations to happen, to go out and talk to a variety of businesses and other entities that are out there to make them aware of this rule, provide support, ask for any barriers, and find ways in which we can provide all of the resources to these individuals. They're going to also be responsible for going out and investigating complaints and violations, making sure that we have all of the information that we need in order to make a decision if that violation is true, or if it's if we need to move forward with some civil penalties and additional fines. So they're going to have a broad spectrum of responsibilities, all the way from outreach, education, all the way to the enforcement of the rule. They're going to be out there every day. As I've mentioned before, these are full-time positions. They're working with us on a full-time basis. They do have flexible schedules in the sense that they do not necessarily work an 8 to 5 type of schedule. So they will be out there even after hours, since we know that certain businesses and areas that might need some education open after 5 and as well as on weekends. So we've brought in a group of team members that are flexible with their schedules to be out in the community on a regular basis. Again, they're going to focus on what we have in our role with proactive and prevention strategies at first, or with entities that we have not received complaints about. And they're also going to respond to the violations, and they may actually notice violations themselves as they're going out into the community and talking to a variety of different businesses, business owners, and so on and so forth. Some of our other team members that are not full-time in this space are going to dedicate a portion of their time to this, and they might be focused on some very specific areas that we identified. So maybe some of the restaurants or some of the local schools or some other areas that we identified. There may be team members that are specifically tasked with those particular areas. When we're looking for the enforcement, we know that there is going to be sometimes a case-by-case evaluation of the situation, and I will let Mr. Payne talk about that just a little bit when it comes to exceptions or the ability to make decisions in that space. And as far as the workflow is concerned, we do have a hotline as well as an email address and a website that are going to be listed in the chat by our team members, where complaints and violations can be reported to. Our team has a triage method to make sure that we know exactly what needs to happen with these complaints. We have a platform, an electronic platform, in which we're documenting all of these situations, so we know who is a first-time violator, who is an entity that we've received multiple complaints from, so we can have a clear track and documentation of what we're doing in each one of these situations. And then the work is being divided amongst our team members. We hope that the community is going to be receptive to this and understand the importance of this rule, we're going to move to an education/warning type of approach at the very beginning when we receive a one-time violation, and give that entity an opportunity to ask us questions and make sure that they have the resources that they need. And if that approach does not work, we will move into more of an enforcement and fines type of approach once we have completed the outreach and education portion. So those are that's the information that I have for you right now as far as the logistics are concerned. And before I'm going to pass it over to Mr. Payne, I also want to bring attention to just two other things. The cases in Guilford County, the metrics that we're looking at right now are going into the wrong direction. All of the metrics that the chairman just mentioned, as well as positivity rate, hospitalizations, ICU admissions, the rate of infection, the number of active outbreaks that we're investigating. We are at a point that we haven't seen since February of this year, or late or beginning of January of last year. So those numbers are really high. These situations are leading to constraints not only on our hospital systems, but also on our own county operations. As a critical function of our society to function appropriately, all of the services that we're providing through Guilford County are incredibly important, from our emergency services to our social services, public health, and a variety of other services. Everything is critical for our society to function successfully and effectively. When we're seeing these types of metrics in our community, that automatically also impacts the services that we're providing. Our EMS teams are being overwhelmed with number of calls. The fact that our hospital systems are also overwhelmed with COVID-19 cases and other cases are leading to high turnaround times for those ambulances in the hospitals, which also create lags in their ability to respond to additional calls. Our social services, our foster care services, they're also being impacted and working 24 hours nonstop, hours and days to make sure that our kids that are in foster care are being taken care of, or the social workers that are working with the vulnerable communities. And then our public health workforce is working around the clock for testing, vaccination, case investigation, contact tracing, and a variety of other activities that continue to happen in the health department on an everyday basis. So I just wanted to bring this point forward. And the last point that I wanted to make is a reminder that the Pfizer product has received full authorization from the FDA on Monday. We are extremely excited about that news, and that is hopefully going to drive a lot of other community members that have not received their vaccines just yet, who are waiting for that full approval. That has happened now. It went through all of the authorization processes, and it just one more time confirmed the fact that these vaccines are safe and effective. And we are urging everybody in our community who is eligible to get the vaccine to go out to the multitude of vaccine opportunities that are in our community and start that, that process. Thank you, and I'll be more than happy to answer any questions. I don't know if Chairman Alston, would you like to add anything before we pass it over to Mr. Payne?
Yeah, I really want, I know some of us had a hard stop. But I do want to give the opportunity for the press to ask their questions. Mark can be here for legal backing and any questions that they might have or that we might be able to have. So we can open it up now to the press for any questions that you all might have.
Perfect.
Okay, if any media agencies have any questions, please use the raised hand feature. All right, I believe it's Lori with Fox 8.
Hi there, can you guys hear me okay?
Yes. Yes, we can.
I just wanted to go a little bit more into the enforcement real quick. I know in round one of this, we had businesses that were in violation and fines considered or given. When we go into this latest round, if they've already had fines, are they going to be fined this time, or does everybody start with a clean slate?
Let me jump in on that. I think that's a good question. And I think not only is it our obligation, I think it's the logical thing to do. Everybody's going to start with a clean slate. This is a new rule and it's going to be newly enforced. And the rule itself specifically says that the first goal is education. And it specifically says the first violation is the warning. Our goal is to educate everybody as to the need and the viability of compliance. Sometimes education doesn't work, and when education doesn't work, then there is civil penalties that are available, and we are going to use those if we have to. But every case is going to be examined on a case-by-case basis. We're going to do our investigation. We're going to make sure that if civil penalties are recommended, that they're warranted. But if they're warranted, we will issue them. Thank you.
Okay, next question, I have Leanne with Hearst Media.
Hi, it's Leanne. Can you hear me okay?
Yes, we can.
Okay, fantastic. To clarify, how many people do you have working on this enforcement team?
So specifically, we have 4 full-time team members that are going to be working on this. And we have 3 part-time employees that are going to work on this as well. And then our entire environmental health team, which comprises of over 25 individuals that are also going to make this part of their duties and responsibilities.
In addition to the resources of the entire legal department.
Thank you, Mr. Payne, for that. Yes.
Next question, I have Avery with WFMY. Avery, are you there?
Yes, can you hear me? I'm sorry. Can you hear me okay? Great. So
We can hear
when someone is maybe eventually cited after their first warning, what is that process like? Is it after the first warning, then it's immediately happens, or there's an investigation? Kind of walk me through that.
Well, I'm not going to tell you what's going to happen in every case, because we're going to take every case individually. We're going to look at something that may appear to be a violation. It may actually be something that falls in an exception. So we're going to be very careful in our process to make sure that if we cite something as a violation, it is in fact a violation. But the rule itself talks about warning first, and then a small penalty, $50 is the first, and it goes up to $1,500 penalties if you have multiple violations. Our goal is education. Our goal is to get people to comply. Our goal is not to issue civil penalties. We will do so if we have to, but the process will go like that. We'll start with a warning, then it'll be small penalties, and then those penalties can grow up to $1,500 per violation. So it can get pretty stiff if that is what we have to do. Those penalties will be assessed. They're civil penalties. There'll be no criminal penalties under this. And we'll take each case as they come, and hopefully we'll get to compliance. I'd be happy if we never issue a civil penalty. I don't think that's going to happen. I think we're going to have to, but that's the process. Thank you.
Okay, next I have Lori with WGHB.
Hello again. Dr. Van, I wanted to ask you, you talked about the metrics going in the wrong direction. Obviously, you know, we've seen, I looked and Cone has not put out its latest midnight numbers yet, but it was 130 yesterday. When you say the wrong direction and the numbers since February, just tell us how critical of a state we are in. And as the health director, you know, your concerns about where we are.
Yeah, sure, Lori. Thank you for the question. So just like I've mentioned multiple times in the past, we are looking at a book of metrics when we're looking at what our community transmission or where we are as a community with COVID-19. So when we're looking at the number of new cases, just like the Chairman Alston mentioned before, we're continuing to see an increase in cases every day with an average of approximately 300 new cases every day. Also, our positivity rate, which used to be somewhere around 1.3 at the beginning of July, has jumped all the way up to 9.6%. We are also seeing more and more individuals going out there to get tested. In the last week, I know that we've had close to 13,000 tests that have been performed in Guilford County, which is above our goal. So that shows that that positivity rate is actually a good indicator of where we are with the transmission. We are also being rated by both North Carolina DHHS and the CDC as a high transmission county, which also takes into consideration a variety of other metrics and data points to make that classification. Just like you've mentioned, the number of people that are hospitalized right now has went on an incredibly steep pattern with 8 hospitalizations at the beginning of the month, all the way up to close to 140 hospitalizations in all of our healthcare systems of Guilford County that serve Guilford County. We are looking for the numbers for today, but we anticipate that those numbers are going to continue to look pretty bad. That is a result of how infectious and how more transmissible the Delta variant is. This is still COVID-19. It is just a more potent, strong version of COVID-19, which also affects a slightly different population as well. If we haven't really seen a whole lot of pediatric community members or kids being affected by COVID-19 before, those numbers are dramatically changing in the last few weeks. So we have seen more kids under the age of 18 being hospitalized with COVID-19, and we have seen more cases of COVID-19 in children going up as well. So it just is shifting a little bit the age demographic. There is still a lot of opportunity for vaccination out there. So all of these together are definitely very concerning because our role as public health is to protect our entire community and prevent anything that could drive negative health outcomes. I know that a lot of times it's really hard to quantify prevention in general because things might not happen. So it's really difficult. But when they do happen and these numbers are showing up and there are more and more reported, it is really concerning to us. So I think that trying to work on all different fronts in so many different approaches is going to be the successful way to go with the vaccination, with the Board of Health rule, with our community understanding that social distancing and mask wearing and hand washing continue to be important, avoiding crowded places, making sure that they stay home when they're sick, trying to do all of the prevention that we have been talking about over the year and a half is still incredibly important. Thank you.
I know we talked about a hard stop at 9:30.
We can go ahead with the press. We can go ahead with the press for a few more because we took a lot of that time.
Okay. Next I have Leanne again with First Media.
Hi, Leanne again. Just a quick heads up. When we're remuted, we can't hear you talk. So I missed the response to my first question as it was telling me I was no longer or I was being muted. Just a quick programming note. So again, how many full-times do you have on this enforcement piece? What is the job title of those folks, of the people on those team? And could you sort of walk me through what the average day might look for someone who's in this full-time enforcement role? I think I'm just having a little bit of a hard time visualizing the rollout of the job. Thank you.
Sure, and we'll be more than happy to send you the answers to the first question, so we won't take up time repeating that. And as far as the everyday work and how that looks like, it's split in two, let's say. One would be responding to the complaints that we receive, going out in the community and investigating those complaints, going into those particular businesses and talking to the supervisors, and then documenting that information, meeting with the team, making decisions on what the next steps are going to be like, and moving forward with any citations that might happen. And then the second part of the day would be more on the outreach part, in which they're still out in the community, they're still going into businesses, providing education and materials to different entities, but these are not necessarily businesses that we've received complaints from. It's just truly a proactive outreach effort.
And I would only add that don't underestimate the importance of that outreach, that proactive approach to trying to educate folks so that we get to them before a violation occurs, and that gets our overall compliance numbers down significantly. I think that was a very significant part of this the first time we had to go through a process like this, and it's going to be an equally important part of this time around.
Thank you so much. And what are you calling the folks in this role? I want to make sure our language is correct.
Everybody that does this enforcement is technically called an enforcement officer. They have other roles, and for the most part, you know, perhaps we should have called them public health educators, because they're using that role as well.
Thank you so much.
Okay, I have one last question I can see from Lori, WGHP.
Again, so just going back to the enforcement, a two-part question. One, I understand like the enforcement team or strike team or public health educators are going to really educate people first, but are these people going to just do random patrols to see if people are following the rules or not, and acting as more, you know, more to catch things that may be going on, number one? And then Dr. Van, when you talked about going to specific areas such as schools and other areas, is that set up mostly to educate?
Yeah, sure. Mark, do you want to jump on the first question, and I'll, I don't know. Yeah.
It's like Dr. Van said, there are two components to it. One is going out to the community. A lot of your folks who are going to be enforcement officers who are assisting from the restaurant sanitation group, they're going to talk to restaurants because that's who they talk to every day. So people are going to be going out in the community, and that, I don't think I'd call it random, but it's going to be preventative, proactive, going out to various folks in the community. The other part of that is going to be responding to complaints. We'll get some complaints and we'll respond to them. We're not going to ignore any complaint we get. So it'll be on those two fronts. I wouldn't call the community outreach random. It's going to be planned. It's going to be trying to hit as many people as possible. And that's going to be a very significant component of it. The other is going to be responding to complaints. We don't know where those are going to come up, but we'll respond to them as we get them.
Any other question?
Yes, I do not see any other questions. Please keep in mind, any of the media agencies, we do have contact information listed in the chat for additional press questions.
Well, we want to thank the media for coming. Thank Dr. Van and Mark Payne, the county attorney, for participating. And if the press have any other questions, you can send that to our communications director, Worley Smith, and he'll be able to get the questions to us and then get the answers back to you. Again, if you can spread the word that if we work together, we can solve this problem. But we really need to get the ones that are not vaccinated. The faster we can get them vaccinated, the faster we can solve this problem, and the faster we can get back to some normalcy. And if everybody wear their masks, like Mr. Payne said, it's not our intent to go out and say, I got you. But if we get you, we want to be able to warn you. And then if you continue to, we continue to have to get you, then we're going to be finding. But we are going to be taking this serious. We're not going to be lackadaisical about this. We are trying to save lives. And that's what it's all about. And we are trying to make sure that people who catch this disease can be treated. Wearing a mask is a whole lot more comfortable than having to be on a ventilator. If you want to be on a ventilator, I mean, you can wear a mask while you're in the businesses, or you can be on a ventilator for days and weeks and months. And I know personally the agony about a ventilator. My father, before he passed, he was on the ventilator for, he had COPD, didn't have COVID, but he was on the ventilator for 2 months. And it was very agony to see him with that ventilator on him for all of that time. So people think a mask is uncomfortable. Try being on a ventilator and having your family members to be on a ventilator, only simply because they didn't wear a mask. They didn't take precautions in order to protect themselves and their loved ones. So if you don't do it for yourself, do it for somebody else. And that's my closing statement. I hope, again, feel free to call me, feel free to call Dr. Van or Mark, any of us, as we go through this process. And hopefully it won't be long. But again, we do have a pandemic that's mainly of those who have not been vaccinated. So we can get the word out to those that are not vaccinated to please get vaccinated. And even those who are vaccinated, you need to continue to protect yourselves and others, because those that are vaccinated can still be a carrier. So that's a precaution there. We need to make sure that everybody wear their masks also, even if you're vaccinated. Okay. Thank you again. We appreciate your time and consideration.
Thank you all.